Well, October is Breast Cancer Awareness Month, and it's time to recognize and raise awareness for the disease.
Dr. Lindsay Jader joins us today to tell us how best to get checked. Thank you for coming in this morning.
Thank you for having me.
Can you tell us a little bit about October and the fact that it's Breast Cancer Awareness Month?
It is. So October is when we celebrate or are aware of breast cancer. Breast cancer is, after skin cancer, the most common cancer that women get. So it's good to be aware of signs and symptoms of that and make sure that you're getting checked.
Why is it so important to kind of break the stigma around, this kind of cancer as well and talk about it more?
Yes, so it's just important, again, because it's so common. We recommend annual screening mammograms for women starting at age 40. And so our goal is to try to find and detect cancers at an early stage so you can minimize any type of treatment that you might need.
And we talk a lot about the importance of kind of self-checking and kind of recognizing when it's time to go talk to your physician and get help. What does that look like and what should we be doing?
Yeah, so self-breast exams are just a part of kind of overall breast awareness. So we want women to be aware just of their breast health in general, what they feel like, what they look like, and then so they know what their normal is so that they can detect any changes or any differences that they might notice. That can be things like feeling something, skin changes, nipple discharge, anything that's different and out of the norm. They should go and have checked out.
Yeah, and I guess what's the treatment look like for this?
So it just kind of depends. So when women come in for a mammogram, they get their screening mammogram, we come back with a grade or what recommendations we would recommend after that. So they could either just return to their screening mammogram and go, come back next year. Sometimes we find things where we need to do additional workup and we want to have them come back and do a diagnostic mammogram. If all of that pans out, they end up needing a biopsy or something like that, and it comes back and they do end up having a breast cancer. Treatment is kind of coordinated with a whole multidisciplinary team and can include things such as surgery, radiation, chemotherapy, but that'd be something that you would have a discussion with your clinical team.
Mm-hmm. And with October being really focused on bringing awareness, how can people get involved and spread awareness and talk about breast cancer this month?
Yeah, so I think kind of like you mentioned, just not being afraid to talk about it, just being aware, knowing yourself, you know yourself best, and then having conversations with other women, not forgetting that men can also get breast cancer, although less common. So trying to break stigma around that too, just talking just in general with everyone about breast health and awareness.
Well, thank you so much for being here this morning.
Yeah. Dr. Lindsay Jader of
Thank
Sanford.
You.